All right. Good morning, everyone. So my name is Kim Johnston, and I am the manager for academics as part of the professional practice portfolio. I am welcoming today's presentation, which is titled "What's in a Story? A Glimpse into the Lived Experiences of Ukrainian Newcomers in Canada." Stories have a unique power to illuminate complex realities, offering insights into resilience, adaptation, and the pursuit of belonging. In this session, we will hear about the lived experiences of Ukrainian newcomers to Canada, exploring themes of social justice, health equity, and community well-being. We are privileged to have three remarkable presenters: Dr. Kateryna Metersky, Assistant Professor at the Daphne Cockwell School of Nursing, Kristina Tsvygun, Critical Care Nurse and Master of Nursing student, and Cosgrove, a Forensic Psychiatric Care Nurse, Master of Nursing student, and dedicated nurse educator. Please join me in welcoming our presenters.
Good morning, everyone. Organizers, it is 9:37, so please don't cut us off at 10. We'll need that extra 7 minutes. Good morning, everyone. Thank you to those who are here in person and for those that are here online. As mentioned, my name is Dr. Kateryna Metersky, and I am an assistant professor of nursing at Toronto Metropolitan University. I'm also a practicing nurse in general internal medicine at Toronto Western Hospital. So everything that I do with my research, I always think, what are those implications for acute care? Another hat is I'm an affiliate scientist with the Toronto Metropolitan Centre of Immigration and Settlement. And so the work that I'm presenting for you today is focused on refugees. We will talk about a study we did with Ukrainian refugees, but you'll see we are presenting sort of three projects that are integrated into looking at refugee mental health and well-being. And for all of you today, what are those implications for the healthcare sector? So as you see, we do have a little bit of a hefty agenda. We'll try to get through all of this within the 30 minutes, but I can talk about this for hours. We are going to talk about a scoping review and focus on a particular population of refugees, starting with young war refugees, then integrate into a knowledge translation study that we did with Ukrainian refugees, sort of older in the adult age range, 18 to 65, focusing on their access to the healthcare system and navigation of the healthcare system, and then dabble into what I'm currently really passionate about and involved in, and that's refugee women and sex work. And we'll talk about a systematic review we did in this area and how that's informing the work that I'm doing right now through a qualitative exploration of their experiences in Toronto. So without further ado, I do have two guests with me today, and for capacity building, not for the students, but for capacity building for myself as their graduate supervisor, but also as their supervisor from a research assistant perspective. I learn from them every time they co-present with me as well. So I have two lovely presenters, and we'll get started with Kristina and our first scoping review.
All right, good morning, everyone. My name is Kristina. I'm a registered nurse with a clinical background in intensive care, and I'm also currently pursuing Master of Nursing at Toronto Metropolitan University with focus on leadership and healthcare policy. And I'm also a first-generation Ukrainian immigrant, as you can say by my accent. So I'm going to present the results of our scoping review on psychosocial stressors experienced by young war refugees in developed countries. All right, so refugees are defined as people who have fled wars, violence, conflicts, or persecutions and have crossed international borders to find safety in another country. According to the United Nations High Commissioner for Refugees, 117.2 million of people were forcibly displaced or stateless in the year of 2023, with 33 million of them having a refugee status. Of these refugees, only 26% of them seek asylum in developed high-income countries such as Canada or US. And here is a critical point: 40% of global refugees are children and teenagers under the age of 18. For these young people, relationships they have with their caregivers are essential for navigating the challenges of displacement and trauma they've endured. Refugees of all ages are particularly vulnerable to psychosocial distress. This can manifest as PTSD, anxiety, mood disorders, and challenges to their sense of identity and belonging. And if we focus specifically on refugee youth, we see that they are deeply affected by their caregivers' experience of distress, which impacts caregivers' ability to offer support. And this can manifest as insensitive caregiving, emotional numbing, hostile intrusive behaviors that further lead to transmission of trauma across generations. And now there is such thing as the immigrant paradox, which suggests that refugee youth who have spent more time in their host country have demonstrated increased levels of mental distress comparing to those refugees who just arrived to the host country. And that largely happens due to the poor access to healthcare, difficulty adjusting to new life, family separation, and accumulated psychosocial trauma. So that is why our scoping review aims to answer the following questions. What are the psychosocial stressors amongst our refugees in developed countries? And what is the impact of psychosocial stressors amongst our refugees in developed countries on the intergenerational transmission of trauma within the parent-child dyad? So our scoping review employed gold standards for scoping review methods, and we included peer-reviewed studies, opinion papers, governmental reports on young war-driven refugees aged 0 to 25 residing in developed high-income countries. We included studies published in English and dated 2010 or later, and we chose this timeline to reflect the exponential rise in refugees during that decade, primarily driven by Syrian war of 2011. And we ended up with 23 sources, which we further analyzed and categorized into these three major themes. So the first theme, pre-migration stressors or traumatic experiences before fleeing a war-torn country that have a significant impact on refugees' mental health, often even more than post-migration stressors. Pre-migration stressors are linked to higher rates of PTSD. In young war refugees, they are linked to academic struggles, anxiety, behavioral issues, and negative coping mechanisms such as substance abuse or gang involvement. And then after fleeing their countries, refugees face numerous stressors and uncertainties during migration, often encountering a long and hazardous journey. For many of them, the journey to the destination country feels like an extension of the war. And upon reaching a host country, refugees often encounter further uncertainties, such as long waits for asylum decisions that contribute to high rates of PTSD and anxiety and depression. And then refugees face identity challenges as labels such as asylum seeker or irregular arrival shape their status and self-perception. And then the last category, post-migration stressors, yielded the highest amount of sub-themes. The first one being language barriers. They pose challenges to their access to healthcare, education, and social integration. Then economic concerns that also hinder language acquisition and force many refugees into low-paying jobs and reliance on social housing, often in unsafe neighborhoods. Separation from family further compounds stress as refugee youth separated from parents show higher rates of PTSD and behavioral issues. Discrimination and stigmatization create additional obstacles as they face negative media portrayals and societal biases, leading to identity conflicts and internalized racism. And then the last theme, parent-child interactions, play a critical role in the mental health of refugee families in total. Parental trauma can lead to maladaptive parenting, insecure attachments, and role reversals when children have to take on parental responsibilities. Of course, our study had some limitations, such as being limited to 5 databases. Grade literature was excluded. We included studies published in English only, and quality of those studies and journals was not assessed. But it also has really important implications for acute care sector. The first one being the need to prioritize language support and culturally sensitive practices in acute care to reduce the identity consciousness stress that refugee patients might feel. And that involves having interpreters, having multilingual patient education materials available. Then there is a need to implement trauma-informed and culturally tailored care to address the unique needs of refugee patients. And that obviously necessitates further healthcare staff training. And the last one is that there is a need to develop partnerships between acute care sector and community organizations to streamline referrals to legal aid, employment, and social support post-discharge for those refugees. And one of the objectives of our study was actually to inform future research projects. And considering that all mental distress that migrants from war-torn countries encounter, they require to have accessible mental health services. But does it happen in reality? So this is actually a topic of my thesis project that's in progress right now, in which I aim to explore mental health services access among Ukrainian migrants in Canada. And you might wonder why Ukrainians and why is it so important to talk about this population today? Well, what we see right now, we see the largest humanitarian crisis of the 21st century. More than 6 million of Ukrainians fled their country internationally, and nearly 300,000 of them have settled in Canada in the last 2 years. This population has extensive mental health needs, and you have to think about both their pre-existing mental health conditions as the population with the higher prevalence of suicide and alcohol use disorder than the global average. And then you need to think about those mental health conditions developed as a result of war trauma and their migration journey. So while there are no studies available globally on mental health services accessibility in general, I suggest that now we'll move away from the mental health sector and explore what do we know about Ukrainians' access to health services in Canada overall. And I'm going to pass microphone to Caitlin.
Thank you so much, Kristina. My name is Caitlin. I'm a forensic psychiatric nurse. And in this section, I will share insights from our related study. As you know, we talked about young war-driven refugees. We also want to think about their families as well. So in this related study, healthcare system navigation and migrants in Ontario, Canada, learnings from knowledge translation workshops. The purpose was to explore experiences of Ukrainian temporary migrants navigating our healthcare system. So as Kristina mentioned, Canada had welcomed over 298,000 Ukrainian temporary migrants with almost 1 million approved applicants for asylum between 2022 and 2024. And while these individuals are part of our community, they're our friends, our family, our coworkers, our neighbors, this population experiences acute, chronic, and complex health issues, including cardiomyopathy, cirrhosis, and ischemic heart disease. And however, little is known about Ukrainian temporary migrants' knowledge of the Ontario healthcare system and their immediate medical needs. So the purpose of our study, we had two main objectives. One was to explore the lived experiences of Ukrainian temporary migrants navigating our healthcare system, and to also report the findings of a knowledge translation workshop intervention with this population to assist in developing knowledge and skills related to navigating our healthcare system. So we conducted a 2-hour workshop with 3 sessions in Ukrainian, and the presentation and focus group discussion was on the differences between the Ukrainian and Ontario healthcare systems, the role participants wanted to play in their healthcare, as well as the collaboration between participants and healthcare professionals for their well-being. So 4 themes emerged from the findings, including concerns regarding accessibility and wait times, difficulty navigating the Ontario healthcare system, transnational health practices, and a desire for increased involvement in their plan of care. So the first theme was accessibility challenges, and one participant stated that they could only access walk-in care services because they had a son who was able to help them apply for OHIP and was able to be there present during the appointments to translate for them. Participants were surprised with the wait times that we have here. One participant recounted that it took over 5 hours for them to see a doctor about their broken arm. Another participant recounted an experience where they witnessed a young child crying in pain while waiting in an emergency room. And they stated, "My husband was angry. He wondered, is this a hospital or what?" As we mentioned before, mental health posed a lot of challenges for this population. So for mental health concerns such as anxiety and depression, this isn't as widely considered in Ukrainian culture. So participants were really disheartened to hear that there's extensive wait times for OHIP covered mental health services here, especially considering the trauma that they were experiencing when fleeing from their war-torn country. So similarly, there were difficulties navigating the Ontario healthcare system. Participants mentioned several barriers, including lack of knowledge, out-of-pocket expenses, and language barriers. One thing that's very interesting is that unlike Ukraine, Canada does not have an online system for accessing healthcare services. So participants really struggled with even finding a doctor, accessing their medical records, getting a prescription. And one person had noted it would be helpful if healthcare workers knew that refugees had limited knowledge of the system and would benefit from more time with healthcare providers to ask questions. Given these barriers, participants plan to travel back to Ukraine despite the war for vision and dental care. As participants cited, it was too difficult to navigate this healthcare system, and they were also afraid of hidden costs. Participants also felt that the providers back home had provided a sense of familiarity and comfort. Again, they worried that the healthcare services were of different quality and, like we mentioned before, lengthy wait times, language barriers. Even one participant noted, "I know exactly who to see, when, and how much it will cost me in Ukraine. Here, I have no idea what the final number will look like, as there are always added costs at the end." And finally, there was a desire for increased involvement in the plan of care. Many participants expressed disappointment with healthcare visits, especially because they were so brief. Like one participant had reported that they waited over a week to see a healthcare practitioner, and their appointment was less than 4 minutes. So they were really concerned with the lack of personal connection with their providers. And they found it difficult to understand why some healthcare practitioners had a policy of one problem per visit, especially when they had so many complex challenges with mental, social, and health issues that they found it was a barrier for them to access care. One participant has stated, in Ukraine, usually right when you do your ultrasound, for example, the person who's doing it can comment on what they see and give you a photo of it. Here we know it's a completely different, it's more complex process. So that was just an illustration of how they felt disconnected from their healthcare provider and their care plan. So I guess we can ask ourselves, what does this mean for us as healthcare providers, educators, and leaders? Well, our research highlights the barriers that prevent Ukrainian temporary migrants from accessing services. Again, language, lack of knowledge, prolonged wait times, services not covered by OHIP. And to address this, we really need to pause and reflect. How are we delivering culturally competent care? We really need to take time to foster therapeutic relationships with our patients and also promote trust in our healthcare system. And so by understanding and addressing these barriers highlighted in our study, not only are we able to improve healthcare outcomes for Ukrainian temporary migrants, but also vulnerable populations who have similar barriers. And we also hope to propel exploration into the experiences of other asylum-seeking groups to learn more about their barriers to care. And as we explore healthcare accessibility further, it's important to understand that how the intersection of multiple vulnerabilities can intensify these challenges, particularly mental health and overall well-being. So I'll pass it on to Dr. Metersky now.
Thank you so much. So as mentioned, we just shared with you two aspects of our larger program of research into refugee health and well-being, and covering and discussing their healthcare system navigation. We thought about, well, what if they present with additional vulnerabilities? And so the next set of slides that I'm going to share with you focus on refugee women's involvement in sex work. And as I said, it did inform a SSHRC-funded study looking at the lived experiences of Ukrainian refugee women having to engage in sex work to make ends meet in the Greater Toronto area. And so the stories that we are hearing, I won't share with you today, but I can say will definitely touch many, many people. And to learn about what is happening in our own backyard, and what people have to resort to just put food on the table, to be able to afford things that are not covered by our Ontario healthcare plan, it will really shock you. Again, I am really excited to do that in a future presentation, but right now I wanted to talk to you about our exploration of the literature in this area to inform this work. We wanted to see what's been done, what's been explored, and what's been investigated. Again, I bring for you the shocking number of 110 million people displaced on a global scale. Syria, Afghanistan, Ukraine, And now we have what's happening in the Middle East. So when you think about the magnitude of displacement we have today, it's numbers we have not seen since the Second World War. So who are these people that are being displaced? A large number of these people are women and children. A lot of the males have to stay behind to assist with the war efforts, particularly for the Ukrainian context. Men cannot leave between the age of 18 and 65. So families are separated, and largely it's women and children who do travel. Some men are able to escape and do end up being displaced as well, but not in significant numbers to help assist women and children as they are navigating this new reality in the host country. Limited English language, particularly thinking about our North American context. Having a lack of North American job experience, I hear stories from women who went to apply to clean hotel rooms, didn't get the job because they didn't have North American hotel room cleaning experience. Think about that. These are doctors, lawyers, other professionals from other parts of the world who cannot get a job cleaning our hotel rooms in North America. But that is their reality. So when they come to this particular setting in their host country to make ends meet, they have to unfortunately sometimes turn to other employment means. And in this case, our focus is sex work. So what are the gaps in the literature? We know a lot about sexually transmitted diseases in this particular population, sexual-based violence. We know very little about health and well-being factors. And so that's what we wanted to tackle. We really wanted to look at what literature is available, what empirical studies have been done, what gray literature is available, focusing on mental health, but also the various aspects of how we define health. World Health Organization has given us that definition that's quite dated, but still true today. We need to look at health from a very holistic perspective and think about all those factors that can be impacting on the health and well-being of certain populations. So the purpose of our systematic review was to identify how engaging in sex work affects the mental health and well-being of women, particularly coming from conflict zones, regions, and countries that are impacted by war. And so what we did is we went into 8 databases, including looking at gray literature from Google search engine, ProQuest theses and dissertations, and looking at essentially 3 groups of keywords: sex work and the various synonyms for sex work, refugee, newcomer, various synonyms for that group, and wellness, health and well-being, and various synonyms. So we took 3 of these groups of keywords, merged them together, looked into the database to see what we could find. For those of you that do dabble into systematic reviews, scoping reviews, 394 might seem like a large number. It's not. It's a very small number, and we ended up actually with only 11 articles. So that goes to show how little we have of information, empirical as well as gray literature available on this particular population. I really love this pictorial representation, but lots of small font. So I will guide you through it very briefly because this is a published manuscript that you can read further on if you're interested. But essentially, it depicts and shows the themes and the sub-themes that we were able to extract from the 11 sources that we included. They talked about fear, not only fear for their own well-being, but for their children and who they had come with. The social well-being and the difficulty of integrating socially in the new context in the host country. Mental and psychological health of even thinking about the fact that they have to engage in this work to put food on the table, but let alone coupled with the stress that we've heard about from the migration experience itself, and then integration in the host country. Economic, financial well-being, no surprise. If they had access to financial supports, financial means, they fared much better in the host country. And so the challenge of, I have to work to have the money, but the job that I'm doing, it's hard to stomach. And then spiritual struggles. A lot of these women were religious or spiritual in nature, having to think how this would look in their own culture, in their own background back home. A lot of them were married or with partners back home, but they had to do this work to support their partners back home, support themselves and their children here. So what? We've presented these themes briefly, I know, but what does all of this mean? They can't hear me? So what? So we've discussed these themes. What does all of this mean? Well, we're able to delineate the significant importance between social well-being and mental health. Even though those were 11 articles, they really pointed that link between social integration and the importance of social integration on somebody's mental health and well-being, despite even working and having to do these kinds of jobs. Sorry about the question marks. I guess it couldn't be read by this computer, but presence of robust social supports is seen as a protective factor. So for us in acute care, thinking about, yes, we are set up to deal with acute care challenges, exacerbations of chronic illnesses, but can we tackle some element of that social support piece and really providing that social support assistance as well while these people are in our care at that episodic period of time? And then no surprise, strong linkage and bidirectional relationship between economic, financial well-being and mental health. Yes, they do struggle with mental health challenges on epic proportions, but if they are able to integrate into a host society that does support and offer some financial, economic support, whether it is with assistance to get employment or some economic advice and supports, their mental health is fared much better. But really the key for all of you today is I want all of you to think about these 5 questions and answer them for yourself. I'm not going to answer them for you. Who needs to be involved in the care of this population or the populations that we talked about today? How should this care be delivered? When should this care be delivered? What should be included in this care? And why does this population warrant this type of care? So really try to think and answer that for yourselves in your own unique settings. So as I promised, this is a published systematic literature review that you can access further in the Journal of International Health Trends and Perspectives. And we do want to thank you for listening, but we're not done yet because I have a little something I wanted to share with you. And based on the interest of time, I do have a couple minutes to do that. If your situation allows, I would like to ask all of you to sit back in your chairs, put your hands firmly on the sides, sit comfortably. And if you can you close your eyes and really be present to listen to the words that I'm about to share with you today. No one expected this to happen, for a brother to attack another brother, but it did. An enemy that we call our friend came to our door and changed our lives forever. The peace and dreams we had, the hopes we envisioned, shattered on that night, on that date we will remember forever. The decision to leave, the journey before us, nothing was easy, nothing brought joy, but now we are here in the land of the free and the land of the safety. But why, oh, why do I feel so guilty? I ran away while those who stayed are fighting for our freedom. I was thinking of my children, of a better future, of a future without fear, of a hope for a better tomorrow. I did not consider the challenges we would experience. A new country means new language, new rules and regulations, the need to start anew and find a job that I can do. I might not like it, but I need it. I need to eat, I need to feed, I need to have a tiny roof. I really do not want to, but I have to. There is no other way to continue. My English is poor, my savings running dry. They promise a quick dollar. They promise of short hours of work that is not hard, of work that is temporary. But I'm a professional back home. And here I have to do something I never thought I would need to do, something that is so taboo, something I would never share with my mother, partner, and you. But this is something I have to do to live here, but to also live in peace. My next worry is our health and well-being. What if one of us gets sick? What do we do? Who do we see? Yes, we have health insurance, but is accessibility of care really that easy? How do I go about it? How do I get the help I need? I worry for the ouch, my tooth hurts moments, for the vision is blurry complaints, for the times I need a prescription, for the times I am in pain. I worry for my children who might need specialized care. I worry for the times I might need to receive emergency care. Do I fly home to the familiar unknown, or do I search here for a doctor who I will wait 2 weeks to see before I can continue to not worry? What are the rules here when your head presents with thoughts that do not go away? The images of war, of our friends being carried in a casket. Of each time my partner does not pick up the phone, my mind goes to the worst. My body gives in, but mental health is not something we talk about culturally. I am feeling so blue. The sadness just cannot leave my mind. This job is scary. My anxiety is high. Will I be safe? Will my physical health remain fine? My brain disassociates completely. When I do the work I need, when I get home, I cannot reconnect. I cannot easily connect to my old self. I'm losing my identity. I continue to sit here and struggle with this fear I have of what if, struggle of what tomorrow will bring. I just want to go home. I just want to be me, but forever I will never be the same woman I used to be, the same carefree, the same full of possibility. And while this is the case, I know how strong I can be. It takes so much of my physical and mental capacity, but I can rebuild, develop new goals, and prepare for whatever will be. For the hope is forever inside of me, for a future free of war, filled with safety, for the unification of my family, for a tomorrow that will reignite that feeling full of possibility in me and all my sisters globally. I welcome you back into this space. Thank you so much for listening. We don't have time for questions, but maybe one.
I have a comment. Oh, sorry. Please go ahead. Mine is a comment if yours.
Thank you for that moving presentation and for giving voice to these vulnerable people that you've brought into our minds and hearts now. I'm going to add to one of your questions at the end, which was beautifully presented as ways of thinking about this. I'm interested in understanding how you, being Caitlin, do you have a Ukrainian background or heritage?
No, but actually my mother and father-in-law are
Yes.
Ukrainian refugees who were displaced. So a lot of this information really resonates with them.
Of course. It's a very personal question, but by diving so deeply into the lives of these people and the research and this work, how do you protect yourselves in this, being so close to this important concern?
So one thing I didn't share about myself in the introduction is I'm also from Ukraine. I was 8 when I came to Canada. I'm not a Ukrainian refugee, but I am an immigrant to Canada. And it's really, really hard. I'm trying not to cry. And even during the presentation, sometimes I cry, sometimes I don't. But listening to the stories, especially in the line of work that I do with refugee women in sex work, I cry in my office after every interview. I find crying therapeutic, so that's what I do, but it's really hard. Sometimes this work is very isolating, but having such supportive students and research partners really does help. It's very hard population to tackle into. There's a lot of research implications. It took us almost a year to get Research Ethics Board approval. We had to go through a full board review, which is a presentation I can do on its own, how difficult that was. But once we got approval, and now that we are able to amplify the voices of these women, as well as other people that we study in various sectors when it comes to refugee mental health and well-being, it's very challenging. It's very hard. So again, it's through supporting each other, through debrief, pre-brief. Before the meeting, we were here an hour before, checking in with each other. We're going to check in with each other right after this and really be that source of support. Thank you.
Thank you so much. That was so powerful. And I really appreciate that you're diving deeply into this understudied and so important to far more understand and support a group of people, specifically Ukraine and then refugees more broadly. So thank you so much. I just have a brief comment, which is because it's an incredible, I live in downtown Toronto and I see the growing number of refugees living on the streets as well. So and I've worked in community health for many, many years, and it's a huge frustration that I have. I don't know how many people here are aware, but in Ontario, at least, there are a sector of primary healthcare organizations that receive not enough funding, but funding to serve non-insured people, including refugees, and that's the community health centers. And and there's groups like Access Alliance in Ontario, here in Toronto, that have interpretation services. And these community health centers, they're not just providing a sort of family physician services, but they have group supports, health promotion, a lot of really robust types of programming to support people with mental health and to come together around food, for example, and other types of programming. Why is it not possible to make that direct connection at the point of entry into the country? Why are people being given shelter intake, but they're not also being given, which is a problem unto itself as a housing solution, but also being given access or knowledge that they can connect with their local community health center, give them the phone number for, if the language is needed, for those interpretation services, for a group like Access Alliance, so that there is that immediate connection and at least some immediate level of support that is going to address their healthcare needs, as well as to some degree, some social needs. So it's a comment because we do have a bit of resource here, but we're not, to that earlier conversation around integration from a different side of the continuum, we're not integrating it, and we're leaving people without resources at all when there are some, not enough. So it's a comment and it's a plea, and if we can all be from our various sectors calling for those connections to be made so that people are not left struggling like this without anything and having to find it on their own.
Thank you so much for that. Absolutely. There is no one central place to be able to do that. We have a pretty tent at Pearson that various Ukrainian community organizations have set up. But again, you arrive, you're stressed, you just got off the plane, you have no housing, you don't know what you're going to eat right after the plane, and you're given a package, and then you're being sent. And where are you being sent? Sometimes there are cars waiting for you. Cars to pick you up to do things that I will leave unspoken. Sometimes there are areas like shelters that you'll have to go and access because you don't have that. A lot of people go on social media and talk to each other. One woman was advised, go rent Airbnb. That is how you get housing in Toronto. Within 1 month, she had no money left. Literally no money, not even a penny, because she spent $4,000 on Airbnb. Our renters in Toronto, what they do is they ask for first month, last month. We're used to that. What about a full year of rent? That's what refugees are facing right now in Toronto. Give us a full year of rent. Who has that kind of money to give up? So housing, we're looking at that. Entrepreneurship, we're looking at that. Employment access, we're looking at that. And now we're also looking at an element of sex work and precarity around that kind of employment. So thank you so much. I am a published poet. This is a poem that I wrote. And a lot of the work that I do, research work, I try to disseminate via poetry using participants' words and experiences. So this is my own work, but again, I'm going to get off the stage before I start crying.
Any mascara?